Good morning, everyone. Thank you for joining us today for this press availability to discuss our decision to have a virtual-only first semester of instruction with Montgomery County Public Schools. We're going to have a quick set of remarks from Dr. Smith, Superintendent of Schools, Dr. Monifa McKnight, Deputy Superintendent, and we also have Dr. Travis Gales, Chief Health Officer for Montgomery County, here today to provide comments. We also have a full staff of MCPS folks to help answer questions. And we also have our board president, Shebra Evans, and our board vice president, Brenda Wolf, here as well. So we're going to start with a few comments, and then we'll go to question and answer. So thank you.
Good morning. This is Jack Smith, Superintendent of Schools. Montgomery County Public Schools has spent a great deal of time, literally hundreds and thousands of staff over the last few months, working with community members to really think about school in the fall when it opens on August 31st. How do we do it in this, what has become cliche, unprecedented time? What we knew is that it had to focus on safety, high quality teaching and learning, and equity for all students. Excellence and equity together are always our goal. As we've continued on in that work, the decision to commit to a virtual only model at this time was made in consultation with many, many people. We have received guidance and direction very recently in the last few days from our county executive and his work very close to this entire situation across the county. We have specifically worked closely with Dr. Travis Gales since the very first cases were announced on March 5th in Montgomery County. He has been a true partner and collaborator, and over the weekend and on Monday, we continued to work with him. His voice is a very, very important voice in this conversation because we must think about how we care for the well-being of our students, our staff, and our families, and how we care for and work with the learning of our students. All of that matters. We've also worked with hundreds and hundreds of stakeholders across the system. And we know that their perspectives are important, but most importantly, we've listened to our chief health officer, we've listened to our county executive who's managing the circumstance across the county, and we've also taken the direction of the governor and the state superintendent. So Dr. McKnight.
Thank you so much, Dr. Smith. And as Dr. Smith said, this has been months and actually days and weeks of collaboration with others to make sure that we're making the best decision for our school system. We know how much our students need their schools, their academic success, and the social and emotional well-being that makes them who they are. And in that consideration, that priority for the system has not changed. And so we fully accept the responsibility of making sure that we will provide a high quality environment that provides a rigorous experience for our students. And we intend to do that in our platform. From the beginning, we faced the challenge of being able to return to school in the fall. And that's why we initially started out providing options for our community. And with that, we engaged and we listened closely to our community stakeholders to make sure we were continuing to navigate different circumstances and the complexity of this situation. And so through that collaboration and through hearing the voices of our stakeholders in so many ways and understanding the complexities of all of the things that that people are experiencing and navigating COVID-19, we were able to think about all of the considerations and again, as Dr. Smith stated, refer back to our health professionals on what are we able to do and what should we do to make sure we provide the most safe environment for our students. And I'll just say our students continue to be at the heart of what we do and why we exist in Montgomery County Public Schools. There's no doubt in my mind that we all want what's best for our students. No doubt in my mind that we all want what's best for our students. We have put systems in place to ensure that all students have access to digital devices and accesses to the internet when they are away from our school buildings. We will continue to ensure that is the case in the fall. We're also streamlining our digital tools and platforms to make it easier for our students, staff, and families to engage in teaching and learning. And we also know that we made an announcement about our student athletes, and we know that's a big announcement within our community. Both our fall and winter seasons are canceled. And just our priority continues to be safety. And so with that, we're thinking about these decisions, and we acknowledge that this is a big change and difference in our community, but we look forward to working with our families and our students and our coaches and everyone who's been involved and invested in these processes to help us move forward. And so these priorities that I just mentioned are things that we're considering in our plan that we will present to the board in our online virtual learning space on August 6th. And we look forward to sharing that information with them and our community members to, again, stay in the space of focusing on what we can do best to provide a great learning experience for our students and supporting our teachers and staff and doing just that. So with that, I'll hand it back to Dr. Smith.
So as I referenced, and as Mr. Turner referenced, we want to go back and talk through that timeline a little more specifically about our impending announcement from Governor Hogan and Dr. Salmon. But first, I want to reiterate the guidance from Dr. Travis Gales. As I said before, he's been a tremendous partner and expert that we could rely on, along with Dr. Earl Stoddard, with Dr. Crowell, all of the Montgomery County Health Department, as well as our other elected officials across the county. But those three individuals and Dr. Gales specifically, his voice has been very important, and it should be. He is the health expert responsible for the public health and the health department for over 1 million residents in Montgomery County. He was clear with us over the weekend and on Monday when he indicated that based on the current state of surveillance, the epidemiology, and all of the other factors, he would not recommend in-person instruction for students inside school buildings at this time. And people are quick to say, well, that's today. What about next week and next month? But what we know is that it takes a long time for a school system to stand something up. It doesn't take hours or days, it takes weeks. We also know that things have shifted. And so I'd like Dr. Gales to share with our community some of the factors that he took into account as he worked with us to provide this guidance. Dr. Gales?
Good morning, everyone, and thank you, Dr. Smith, for the opportunity to speak with you all and work with you all throughout the last few weeks and through the pandemic. I think, let me be clear, so I speak to you as your health officer as well as a pediatrician. I think we all agree that in-person instruction is the gold standard. And in a perfect world and in a pre-COVID world, that would be the recommendation. However, we're not at that place anymore. And quite frankly, over the last several weeks, we have moved from a place where we had positive momentum, not only here in Montgomery County, across the state of Maryland, but across the country. Our realities have changed over the last several weeks that have shown us that there are over 40 states that are experiencing increases in cases, including in Maryland right now. And even though our numbers have plateaued to some degree here in Montgomery County, which is great in the setting of increases in other places, it still demonstrates that we have a lot of work to do to drive our numbers down even more, to alleviate and diminish the impact of the virus in our communities. We know also in Maryland over the last couple of weeks, we've seen an increase in pediatric cases, those ages 0 to 19, particularly in our teenage population, which is concerning. Again, if we were to open up right now, it creates the opportunity for transmission to happen easily and seamlessly. And even if adolescents and young adults are less likely to have symptoms and worse outcomes compared to our older residents, it means that they are able to go back home to their spaces and their parents and their grandparents, as well as expose our teachers and staff to it who may have a higher risk of having an adverse outcome. So the guidance that we provided to the MCPS team is rooted in the reality that the numbers have not improved overall in our county, as well as the state and the nation, to a point where it's safe to have our children go back to school. Now, we'll continue to monitor those numbers and continue to provide updated guidance to the MCPS team. I have no doubt, based upon their track record in working with them over the last 3 years, and particularly as it relates to the COVID pandemic, that they will do anything less than factor those things into their decisions and work hard to make sure that there are provisions in place. The last thing I'll say is that the MCPS team has created numerous plans and strategies and ideas in terms of how to bring kids back safely. And I'm confident that when the numbers improve to where we can feel comfortable and confident that there will be minimal risk to students and staff in those settings, that the plans that they have studied and have reviewed and analyzed will be adequate to address those concerns. But simply put, right now, the numbers don't match up in terms of creating a safe environment for us to feel comfortable for students and staff to be able to execute the education agenda while maintaining their personal and professional safety.
Thank you very much, Dr. Gales. Much appreciated, and we will continue to talk with you daily and weekly and as we go through this together. Thank you. As I said before, we anticipate that Governor Larry Hogan and Dr. Karen Salmon, the State Superintendent of Schools, are going to provide an update, and we'll review all of the guidance they provide and look at that and confer with Dr. Gales and our county government and factor all of that in. But let's be clear, we're going forward under the guidance of our county at this point, and that's how we're going to do our work. On August 6th, just a couple of weeks from now, we'll provide this updated plan and this information to our Board of Education. However, I want to be clear, we have talked to our Board of Education members individually weekly, and we talk to them all the time, and we send them information so that we can keep them updated. So they have been tremendous partners, and we have been side by side in all this, and I just want to take a moment and thank them because they really have been. Not every school superintendent, school system has a board that responds the way our board has responded over the last many months. And so I'll say publicly, thank you to the Board of Education for your work and your partnership in all of this together, because they are ultimately responsible for the governance of the school system. So on August 6th, we'll present all of that. We'll give them all the information. We're going to focus on our virtual platform on August 6th. We're going to keep putting information out between now and then about how these things will work. One comment I would make that I think is particularly important is no one has ever done this before. And we know that, but no one has ever done this before. It's easy for me to sit in my living room and tell other people how to do their job. But the fact is that we're all working together, we're listening, we value the opinions and the suggestions. I write back often to people and say, we appreciate your suggestion. I've already shared it with the staff and the community members who are working on this. And so please know how much we value that and know that we're all trying to figure this out together. We'll go into school on August 31st with a fully virtual platform. It will be very rigorous and dynamic experience for students. We're committing to that. Our staff is committing to that. Everybody understands that's what has to happen. I've heard from many, many teachers over the last week who've said, I understand this is what's going to have to happen if we're in an all virtual platform. And it's my expectation that that's what we do for our community, and we will continue to ensure that happens. So we'll work through first marking period. It ends at the end of the first week of November. So we'll start in October, working with Dr. Gales, looking at information and analyzing the situation. We'll stay in close touch with our school board, and we will then come to the point at the end of October, very beginning of November, when we're able to determine if we can begin to stand up the mechanisms, the strategies, the systems that will allow us to start school in a blended model of whatever it may look like at the beginning of second semester. So that is at the end of January, the 1st of February. And that's the timeline we're under now. No one would have chosen this. No one likes it. There are no good options. They're difficult, hard options for everyone. And we have to weigh always the well-being of individuals, the safety, the physical, social, psychological well-being of people, and the learning together. They cannot be separated. So we'll continue on together. We appreciate our community. We appreciate all of the people that provide their thoughts and reflections, and we'll continue this effort together until such time that the world shifts, and hopefully that will be at the end of January. We'll be able to shift the world of school significantly. I will now turn it back over to Mr. Turner and his team.
Thank you so much, Dr. Smith. So now we'll take some questions, and we already have a few lined up. So first up is Chris Gordon from NBC4. If you have a question, please raise your hand, and we promise to get to you. So thank you.
All right. Well, thank you for continuing these very valuable weekly updates. People are asking about canceling school sports for the fall and winter, given that students, especially in segments of the county that are not affluent, that students need school sports to get scholarships, to go to college, to continue with higher education. So can I ask Dr. McKnight, can I ask Dr. Smith and Dr. Gales about the concern that must have gone into the decision to cancel not only, well, fall and winter sports, knowing that it's part of family planning for what kids do. Future of some students, the potential of going to college and higher education.
Well, I'll start, Chris, and thank you for being here. It's not just sports programs, it's all of our extracurricular and co-curricular programs that are so important to our students. And we understand that this is devastating, and we're going to continue to look at how we can support students through the digital world or whatever other strategies that people may be able to come up with. I've seen some examples of this that are really tremendous, and we're going to continue to push hard to make sure that we can do whatever we can do in this very important part of a student's educational experience. Dr. McKnight.
Thank you, Dr. Smith. Chris, thank you for raising that question, because we have been really thinking about all of the different differentiated things that we have to consider for our various communities. And we're taking that in mind with sports and other things. This summer, we've actually learned from a number of our elective programs that we offered in summer programs, how actually critical they are for students and maintaining their support for social emotional being through different elective programs and things like that. So that's something that we're looking at and figuring out how we can make some of those opportunities even more available throughout the school year as we focus on well-being, and sports is a big part of that. I'll also say our director of system-wide athletics, Dr. Sullivan, he has been in contact with all of our coaches already, as well as the Maryland Public Secondary Schools Athletics Associations, and just really thinking about how will we manage this, because we have had this collaborative relationships with many other systems as we're all managing the complexities of this. And so we all be very thoughtful and creative and collaborate with one another in terms of thinking about how do we manage this for our students and how do we support them knowing that this will be a significant change.
Thank you. So we have a few other, we'll come back to you, Chris, if we have time. But next up, we have Caitlin Peets from Bethesda Beat.
Good morning. So my first question is, with this decision for the fall, do you foresee having to either furlough or lay off any of your part-time or building services workers? If not, how will their job duties and their responsibilities change in this new environment?
One of the commitments we made, and we worked with the associations, with our school board, with our county government as we went through the budget process this spring, was to keep the school system intact. How we do that at this point, I don't know. But certainly that's going to be one of the things we're going to work very hard to do, to keep the school system intact to the greatest degree possible, and to use our employees in the most effective manner possible. And I say all of that knowing that we have tremendous budget pressure both at the local and the state at this point. And so as this unfolds, we'll continue to share that with the community and interact with our associations and with our community members, our government officials in Montgomery County, and but we need our school system. And as Dr. Gale said, when we can come back together in a more typical fashion, we need to have systems in place that we've always counted on to make the school system operate.
Thank you, Dr. Smith. Next up, we have Aisha from Fox 5.
Hi there, Dr. Smith. I've got a few big questions. First, I guess, what is being done over the summer to make sure that kids don't have any technology access problems come August 31st? And second, how will attendance be enforced? What kind of consequences will be pursued for students who do not get online? I have two more questions after that if we have time, but those are the first two big questions.
Okay, the first one with technology, that was one of our three intense areas when we shifted our budget significantly in the spring to make sure every student has the digital devices they need and to the greatest degree possible the connectivity they need. We did a tremendous amount of work in the spring around that with Chromebooks and with MiFis, with our cable and internet providers across the county. We've continued that all summer. And when we start school, students are going to have the digital devices they need, and we're going to, make sure that they have the connectivity if it's within our power, and staff too, because some of our staff live in places where there's not good connectivity. So all of those things are being worked on intensely this summer and really focused on, because it's as necessary as a textbook was 20 years ago, have these tools available to you. And then I'm sorry, could you repeat your second question?
My second question was about the attendance. How much attendance will be enforced? How will you monitor that? How do you pursue students who do not get online?
We actually started back at the end of March when all of this really started. We realized, we were chunked at that time. So we were going to be closed until April 24th and then until May 14th. And then finally the state closed until the end of school. So we started at that time with a set of business rules about what actually we could legitimately call attendance and engagement. And so we've never approached it from, well, we heard from this student once, or one person talked to this parent once. So we're continuing to refine those rules, that we have to have this level of engagement from a student in order for it to be counted as attendance and engagement. And when we don't, rather than just counting them absent, our schools already in the spring, and they're doing it again this summer in the summer programs, move into a case management approach, where a school receives a list of the students that we know haven't logged in, and then they had 5 phone calls with them this week. So we keep track of all of that information, because we know that the engagement with school is so absolutely critical. And part of what we're going to do starting August 31st is continue to have ever more accountability around that and ever more urgency about reaching every single student, whatever it takes.
And Dr. Smith, are you anticipating, is there going to be...
Can we circle back to you? So we have a couple more people in the queue. So Kevin from WJLA.
Hey there. So what's the plan in place for parents, families where there's only one parent in the home and that parent is not able to work remotely, or two-parent households where both parents are unable to work remotely, particularly when you have students of young age and there's not money that's available for childcare or no options in place? In talking with some people, that concern is definitely out there.
Thank you very much, Kevin. That's an incredibly big concern in our community, our state, and our nation right now. And we are very concerned about just what you say. One of the things we want to do is continue to develop in our virtual platform both the in-person live experience, but also making that available at other hours of the day so that families who find themselves unable to take advantage of it for their young children during what would be the typical school day will have access to it in the non-school hours. In terms of childcare, that is a community question, and we are certainly an important part of that whole solution, but we can't be the whole solution. So we're working closely with our local government, with the ICB that manages the childcare programs in our buildings, to come up with solutions that we think might help families and come up with those solutions in collaboration with the health department and the other agencies across the county. Ms. McGuire is our Associate Superintendent for Operations, and I think she could share some good specific insights on how we're doing that if we could bring Ms. McGuire into the conversation.
Thank you. And as Dr. Smith shared, there are conversations absolutely happening with our child care providers. And of course, we have a range of different kinds of child care providers in our facilities. Some of those facilities have been able to open already under guidance and direction that we've had with the state and with the local health department. What we're really going to be moving into are discussions with those providers that share some of our spaces, both early childhood and school-aged students. Of course, those conversations are going to need to be, again, very closely aligned with safe operations and practices, with guidance to meet public health requirements. We know that our child care providers are working very diligently on understanding and applying and implementing those practices themselves. So really, we will absolutely be having those conversations around how we're able to support that. But I also want to reiterate what Dr. Smith said, that it is a community question. Because again, we're a part of that conversation, but clearly that conversation will expand well beyond the school system and our supports.
Thank you, Ms. McGuire. Next up, we have Annika from Silver Chips.
Hi. So something that county leadership, especially past and present board members and student members of the board, have been emphasizing is the need for increased mental health support and counseling, especially because of the pandemic. So what steps is MCPS taking to provide virtual counseling for students, especially in cases where they might want a private session that their parents, their family members aren't really privy to?
So that's been a big area of emphasis for the last couple of years as a growing concern in public education and in the community at large. One of the reasons that we developed the framework around Be Well 365 was to really push that physical, social, and psychological well-being out front. We're undertaking a lot of efforts in that area, and I would like to ask Dr. Wilson, our Chief of Teaching and Learning in Schools, to share with you some of the things that are happening in our Student Services Division and in our Schools Division in particular.
Thank you, Dr. Smith. Certainly, this is an extremely important area of our work as we continue to stay connected with our students. We stood up with the efforts of lots of folks under the Office of Teaching, Learning in Schools to provide a robust summer program to stay connected to as many of our students as we could. We also know that in our schedules for the fall, we will be building in intentional blocks of time that are structured for providing social and emotional learning support to our students. In addition to that, there's work going on with our Office of School Support and Family Engagement with curriculum and instruction to ensure that our lessons are designed to ensure that we have social and emotional components built into our curriculum, so that when the nuts and bolts of the curriculum are being delivered, that the important attributes of social emotional learning are embedded in that delivery. In addition to that, we are exploring grant partnerships and with some of our healthcare providers, our mental health providers, to provide intentional support to students as they are identified by school staff as needing additional social emotional support. That's work we're doing with some of our peer counties across the state, and has been supported with our county council in terms of they also recognize the importance of the mental health component. So that work continues. We are looking forward to providing an update to the community on August 25th around our social emotional supports for the fall. That will be one large presentation to the Board of Education and the community on that day. So thank you for that.
Thank you. Next up, we have Kate Ryan from WTOP.
Hello, I'm curious about, I know that the governor's going to hold a news briefing at 5 o'clock today, but what additional guidance do you expect or need from the state? And second question on addressing learning loss, how will you enter the new year assessing where kids are And what are the grades going to look like for the coming semester?
So 3 important questions, Kate. The first one is what we need from the state is the ongoing, very quick response from the Maryland State Department of Education around some key questions. So when we are able, and I hope we're able to bring students back into schools at the end of January, if there is a case identified in a school, we need a consistent statewide response. Because if there's a case identified in Washington County, St. Mary's County, Montgomery County, or Worcester County, it doesn't really matter. We ought to have the same set of protocols. So we've been asking the state for that. We also need a real strong, quick response when policies need to be changed. The MSD was very good last spring about changing regulations and policies that became barriers to students. And for example, one that needs to be changed this coming year right away is around service learning. The state of Maryland requires it. It's a very different world. They need to change that right now for all the students who are in place and under that system right now until things go back to a way of working that allows for that. So those are a couple of quick examples of things that we need on the ground. And then we just need to continue to hear where the state is and where it's headed. So we need some consistency and we need some flexibility always. Those things are very important. And your second question was?
I'm sorry. The second question on addressing learning loss as you move into this coming semester. And then how do you address grading for yet another semester?
So I'll start with the grading question first. We're not going to use the grading system that we had to craft in the spring because of the emergency situation. So I said at the board meeting last Thursday that we would be returning to the MCPS grading system. And I received a long, thoughtful email from a high school student who said that, you were very quick to say this. And I would say at this point, I wasn't very quick to say it. We will have to revise our grading system in areas and places, but overall, we want a framework that really reflects the students' work, their learning, and their progress. And what we had to use in the spring, it sufficed in emergency situation, but it's not what we're going to do this fall. We're going to return to a more standardized grading system and move forward. Although I would say the data we looked at the board meeting last week was very interesting. Most of our students our high school students chose to receive letter grades. And that matches our engagement information. And then the third thing is the most important conversation in the teaching and learning realm, and that is what's happened since the middle of March. We completed about 75% of last school year. So what's happened since the beginning of March to student learning, and what's happened to disparities that exist for different student populations? Montgomery County is fortunate because we've been using the NWEA MAP assessments for years, more than 10 years. And so we'll continue using that information. We've been in close communication with them since the beginning of this era, back in April. And we'll continue that work, and we expect to be able to report to our board at the end of October what we think the state is of student learning and different student populations, different grade levels, different subject areas. And then part of our budget strategy last spring was to make sure that we had money available to us for this summer, which has a tremendous, robust program, and then all through the year to do out of school time and in school time support where the data and the evidence suggests that students, either the disparity has continued or it's grown, and where can we accelerate and support students throughout this year as we look at that data that we'll be reporting to our community and our board in October.
Thank you, Dr. Smith. And we're already a little over time, so I'm going to leave the last question to Mariah from Washington Post.
Hi, thank you so much for holding this briefing. 2 quick questions. I wanted to know if there's going to be any requirements that you offer synchronous learning as opposed to asynchronous, or perhaps even just Google Classrooms. And then I also wanted to know what you're doing, or if you're concerned at all that you're going to struggle to get kids to re-enroll their kids or to enroll them to begin with, given that there won't be in-person schooling. And I know that a lot of districts have had trouble even tracking kids down.
So I'm going to answer the second question first, and then I'm going to ask Dr. Wilson to share some details and insights about the two words that everyone in public education and the community has learned in the last few months: synchronous and asynchronous. Those have become common words now in everyone's vocabulary. And so as we think about enrollment, what I can tell you right now is as of July 1st, our growth in enrollment had really slowed down. We were expecting over 2,500 new students when school resumed in late August and during the month of September. That we thought that would continue to grow until our official count on October 1st. We've only enrolled kindergarten through 12th grade about 300 new students as of July 1st. Now that may have grown. I've been waiting for the July 15th update, and I'll know more about that as soon as I get it. We check that the 1st and 15th of every month. And then in terms of family choice, I would say definitely we'll have families who make other choices, because as one of the prior questions indicated, families have tremendous different circumstances. And I speak sometimes about my own children and their children and the choices they're having to make, not because you care about my children, but I want people to understand I live this personally and professionally. And I understand that whatever choices parents have to make, that I hope they have good options available for their children. I hope their children learn and grow and develop and have a strong sense of well-being during this time. And we'll support any and every parent that chooses to be part of Montgomery County Public Schools, and will wish the very, very best for every other family, no matter what they choose. Because this is a tough time. It's not the time to be getting after people or yelling or screaming at people. It's the time to be understanding, considerate, and helping people any way we can.
And so just to be clear, you think the drop in enrollment is people choosing other educational options?
No, I think I didn't say there was a drop in enrollment. It's a very important distinction.
Yeah.
I said the growth has slowed. So the growth has slowed, and I think that is not so much about educational options. I think that is about the quarantine and the lockdown of people, and there's much less mobility, and also about lots and lots of people losing their jobs or part of their income. That's pervasive in our society. If you pay attention to what's happening in the private sector and in many other school systems and many places across this country. And so they don't have the mobility, and they're also, we think, lots more families having to live with other family members, just a lot of very difficult, hard circumstances that aren't allowing for the level of mobility and choice that people had before this pandemic.
And Dr. Wilson, the last comment on, you asked about asynchronous and synchronous. So if you could talk a little bit about that, and then we'll close out.
Sure. Thank you, Derek and Dr. Smith. I just want to reiterate that our plan for the fall will be to provide robust and dynamic virtual learning experiences for our students. What we will be offering in the fall does not and will not look like the continuity of learning experience, which was really an educational response to a crisis situation. We have had time to plan for a better, more robust delivery that will include increased synchronous time at all levels. But in addition to that, we are planning for those unique family needs where they do have to have asynchronous ability to pull on lessons that were delivered at a different time of the day, so that we can accommodate the unique needs of our families who have work situations or other situations where they may not be able to tune into the live instruction. I just also want to make mention that we also are exploring creative ways to support students receiving special services, and that time to address special education needs and ESOL services are going to be built into that full day instructional delivery format.
Thank you so much. And on that note, thanks everyone for joining this media availability. Thank you.
Thank you.